My name is Mike Rosen, and I'm an assistant professor in the Armstrong Institute for Patient Safety and Quality. My background is human factors psychology, and one of my areas of research, or my main area of research, involves coordination in healthcare systems. We focus on that in a number of ways, but recently we've been focusing primarily on accountability across levels of the organization, and how do we align and coordinate efforts from our executives all the way down to the bedside and the patients and families as well. Many times in healthcare organizations, frontline staff may not know what our safety improvement goals are. We may not know how well we're performing relative to those goals. There are lots of misalignments that we see on a regular basis, and we're really trying to focus on mechanisms to improve that efficiently so we can all get the most out of our efforts working together. We address this kind of breakdown or misalignments in this chain of accountability through a number of mechanisms. One that we're focusing on now is the use of simulation. Simulations gained a lot of momentum as an educational strategy in healthcare. For example, training the clinical skills and teamwork skills of responding to a cardiac event. But we're designing simulations at a higher level currently for our executive leaders, for our mid-level leaders, for our unit-level leaders, for them to be able to learn better management practices and to experiment with new ways of designing work. So for example, these leaders can participate in these organizational simulations and design new ways of setting goals and communicating those goals to staff, new ways of sharing information on how we're performing as an organization. I've chosen to focus on healthcare and patient safety because the opportunity is so great. We need better ways of organizing work. We need better information tools to understand how we're currently performing and ways to improve. There's a huge opportunity to take what we know, to use the existing science, and to build better systems that will get us what we all want, which is better care for our loved ones, our family, and our community members.